Health officials agree that we are past the point of containment. We're not stopping this thing, and instead we're into mitigation. And one of the primary concepts there is what's called flattening the curve. Even if the same number of people get the disease, it's better that that happen over a prolonged period than all at once. Because if you and I and everyone we know get it right now, that's going to create a peak of infection that's going to crash our healthcare system. If instead we have a long, flat curve of new infections, that's something that hospitals can deal with far more easily.
UC Berkeley epidemiologist Dr. Art Reingold specializes in who lives and who dies during epidemics involving respiratory infections.
So if you go back to the polio epidemics of earlier days or the flu pandemic of 1918, there are a few examples of communities walling themselves off and basically saying nobody comes in from the outside, who avoided the epidemic, if you will. That's not so easy to do if you're in a city. There are a few complexities to walling yourself off in terms of food and other necessities.
But in China, whole cities have been shut down, cutting off transmission. Here in the United States, there's almost no history of any epidemic being checked by that kind of action.
Dr. Reingold is betting that herd immunity is how this will end.
If we're starting with a population where no one is immune to this virus, which is what we assume, we can get to high levels of immunity, which will basically drive down transmission and prevent infection through at least two ways. One is vaccination, if and when we have a safe and effective vaccine. And the other is that basically much of the population is immune. We call that herd immunity. Basically, you get reduced circulation because the virus just can't be transmitted to people who are immune. We would rather do it through a vaccine, but a vaccine is not going to be here in time to allow us to do that at least for 12 to 18 months. So.
I asked my own science advisor is Bill Gates, so I talked to him. I call him. I've talked to him the last few days about it, and he's bullish on the long-term outlook for a universal prevention of it. But he says it's not going to come. It's not going to be here in 10 years.
What are Bill's concerns as somebody who spends a lot of time traveling around the globe, as somebody who is trying to help medicine in some of the less developed parts of the world?
Yeah, the Gates Foundation is very active in trying to be helpful on this, and Bill says the CDC is the best in the world, and I mean, we've got terrific resources in this country, but a pandemic is a pandemic, and there's just no evaluating. But I have heard that the summer is not likely to cause the end of this.
Do you know?
But I have heard that the summer is not likely to cause the end of this.
Do you know why?
But I don't know, and you shouldn't be asking. I shouldn't be offering my opinion on that, because I pass along things I hear from people I think are smart, but
I'm actually asking for Bill's opinion, not yours.
Yeah, well, I shouldn't really quote him, but I do. He's the guy I ask, and I did talk to him just a few days ago, and he loves to talk science, and he can make it so I can understand it, which is quite a trick.
Well, Dr. Anthony Fauci, called America's doctor by a member of Congress, is leading the charge on vaccine development in the U.S. He said at least 10 vaccines are in development to try to prevent COVID-19 infection. And his program at the National Institute of Allergy and Infectious Diseases has moved at a record pace.
Getting it into phase 1 in a matter of months is the quickest that anyone has ever done, literally in the history of vaccinology.
Made by biotech company Moderna, the first batch of the vaccine was delivered for human testing in just 42 days. But starting human trials is just the beginning. The first stage, phase 1, will take 3 months to determine safety, Fauci said. Then another 8 or so months in phase 2 to determine the vaccine works to prevent the disease.
So when you've heard me say we would not have a vaccine that would even be ready to start to deploy for a year to a year and a half, that is the time frame Now, anyone who thinks they're going to go more quickly than that, I believe will be cutting corners that would be detrimental.
Why so long? Because unlike a drug, a vaccine is given to healthy people, so the risk tolerance is lower than if a person is already sick and needs to be treated. Drugs may move more quickly, both for that reason and because some were already in testing or approved for other diseases.
Of producing something that can change the course of this epidemic is extremely exciting.
The company is targeting human testing by late summer and is optimistic enough that it plans to simultaneously begin producing 200,000 preventative doses per month.
We're going to know probably by April whether that drug works or not. And that's important because that's a drug that can save lives if it works.
Another biotech company, Regeneron, plans to test a drug for rheumatoid arthritis to see if it could help tamp down dangerous immune system flare-ups that can happen to some patients with COVID-19. But it and others are also developing new drugs as well. Regeneron aims to have hundreds of thousands of doses of a drug ready for human clinical trials by late summer. Its approach could both treat disease and potentially prevent it. In San Francisco, startup Vir Biotechnology has yet another approach. It's isolated antibodies from people who recovered from SARS, a disease caused by a different coronavirus.
One place that it's still really thriving is in its groups. Facebook groups is a feature of the platform where people can gather and sort of talk about any topic, really. And there are almost 100 right now coronavirus groups led by people that are not doctors, are not medical professionals, and aren't experts, sort of leading these discussions. Where that can get dangerous is sometimes these groups are called something like coronavirus CDC updates, but they have nothing to do with the CDC. And they're really spreading hoaxes, lies, misinformation. And so you have to be really careful about what kind of groups you're following, if you're following these groups at all, and really source out the information.
But then that news that you broke during your hour of Tom and Rita Hanks in Australia, Tom Hanks tweeting out tonight a very upbeat statement by Tom Hanks about himself being infected with the coronavirus, and his wife, Rita. And of course, Tom Hanks is going to put a very brave face on this, which he has done. And I hope all of the kind of positive feeling that he conveys in his text about, in his tweet about how this is going is true. I'm sure it is. But that's a real face now. That Tom and Rita Hanks is a real thing, a real fact. I'm sure it is, but that's a real face now. That Tom and Rita Hanks is a real thing, a real fact. That's a real face now. That Tom and Rita Hanks is a real thing, a real fact for Americans to consider. If it can happen to them, even though they are in Australia, it can absolutely happen to anyone. I think that's a reality now through Tom Hanks that a lot of people might not have had without Tom Hanks' announcement about this tonight.
And for that to be happening while Mr. Hanks and his wife are in Australia, which is where they were diagnosed, which is key to us learning this, because that's why likely they were able to get diagnosed, because they were in Australia and not here. Who knows how they would have been able to get access to a test here.
We've been very clear from day one that we're going to see further spreading and we would see more cases. The most important issue right now for your viewers would be the elderly, especially the medically frail elderly, as well as any individual with certain medical fragility issues like liver disease, kidney disease, diabetes, recovering from cancer or an immunosuppressed condition. These are the individuals globally that we've seen who tend to get the most severe consequences from getting the virus. Most of us, if we contract the virus, get mild to moderate symptoms globally.
All right, Secretary Azar, thank you very much.
And don't nobody want their child to be sick, and don't nobody want to take that virus to their house.
Parents with children at Treadwell Middle and elementary schools are not playing around. Many wiped their kids down, and some even sprayed them with disinfectant spray as they took them home Monday.
And I wiped my children's backpack down when I got them out of school. Sure did. Gave them gloves. Sure did.
Parents are doing this after they found out an employee who works at Treadwell Middle and Elementary came in contact with a person who tested positive for the coronavirus in Memphis. Some took more extreme measures.
2 garbage bags My shoes and came and do 2 sacks, another sack.
Leaders with the Shelby County Health Department say this is not necessary because it's a very low-risk situation for students. Still, family members tell me they don't want their kids in school.
It's messed up. The flu killing more folks than that is, so what's up? We're going to die anyway.